Hello, PsyQ community, and welcome to part one of our two-part series, Shared Decision Making and Patient Empowerment in the Digital Age, a conversation between a clinician and patient advocate. Today's presentation will be shared decision making and the use of digital tools. I'd like to thank you all for joining us. My name is Mark Takolowski, and I am a clinical science liaison for Otsuka Pharmaceutical Development and Commercialization Incorporated. I'll be serving as the moderator for today's discussion featuring Dr. Adam Kaplin and Kathy Day. This presentation is sponsored by Otsuka in Lundbeck. If you or someone you know is in crisis, please call the Suicide Prevention Hotline or Lifeline at 1-800-273-TALK or text the crisis text line at 741-741. Let's walk through our objectives. Today, our speakers will give an overview of shared decision making and the latest research on it, review strategies and technologies for implementing shared decision making, and discuss how clinicians and patient advocates can work together to facilitate shared decision making. With that, I'm going to turn the presentation over to our speakers. Kathy, would you like to get us started?
Thank you, Mark. I'm so glad to be here, and I'm really excited to talk about this topic with everyone. Shared decision making is a very important topic, and it's something that is really easy to incorporate and very necessary to improve the outcomes for patients. So what is shared decision making? Shared decision making is when the clinician or the provider works with the patient to educate the patient and listen to the patient and uncover what the patient's desires are in treatment, what their outcome is, what they want, and respect that. It involves the clinician providing evidence-based information to the patient, educating that patient on the options, listening to the values and the perspectives of that patient, and ultimately coming together to agree on a course of treatment. Generally, there would be more than one option of treatment offered to the patient so that the clinician and the patient can discuss the benefits and the negatives of both of those treatment options, or maybe there's a third treatment option. So they will come together by truly communicating and listening to each other and trying to find out the best way to keep the patient engaged in treatment, as well as providing the best outcome. So shared decision making is basically teamwork and communication. And that's pretty much all it is just, listening to each other and learning and respecting. So in the case of a clinician and a patient, the clinician has the professional expertise. They have the evidence. They've gone to school and they've learned all about these treatment modalities and medications and whatever happens to be the treatment plan. So they are an expert in that side of the shared decision-making paradigm. The patient, on the other hand, has their own lived experiences. They have their preferences. They have their own values. And more than anything else, they need to be included in making this decision to empower them, and so it's just a way to communicate for the clinician to basically set out the table and explain what the benefits are and the cons are to the patient. The patient can then ask questions and learn from that clinician and make an informed choice on what treatment plan they're going to go forward with. Dr. Kaplin, do you have any information on this?
Happy to weigh in. So thank you, Kathy, and it's great to be here. It's a privilege to work with you, with Mark, and of course to everybody who took time to be here. One thing you said, Kathy, that really rang true with me was the teamwork component of that. When I was just sitting listening to you, what I realized is that team makes a wonderful acronym where you've got at least two people, the patient and the clinician, providing mutual education, one for the other, where they're reaching an agreement through a mutual process of helping one another to understand the patient's previous experiences, their beliefs, their values, and the like, and then the clinician providing what they are educated to be able to provide about the information. So I think teamwork is the key. So in terms of shared decision making, it is the gold standard. It's endorsed by numerous organizations, including the National Academy of Medicine. The World Health Organization has also been very active in promoting it, the Institute of Medicine, et cetera. And it really is something that has grown in appreciation over the last, really the last 2 decades. It has been around for 100 years, the concept, but really in the last couple decades. So studies on shared decision-making and mental health specifically have found that, one, it improves the quality of life. 2, it increases patient autonomy, their ability to make their own decisions and guide themselves. You see our patient here at the helm of his ship or her ship, in control. That's the goal, is to get them back, because mental illness, any chronic illness, and mental illness perhaps in particular, gets that person into a place where their boat is spinning out of control, and we want to help restore their autonomy and self-efficacy, and feeling like they are playing an active role in controlling their lives. 4, it can improve symptoms of depression and anxiety. Though few studies have investigated this, we do need more studies in general in medicine and in this particular area. And then 5, it reduces substance abuse and has again, a growing appreciation. One of the things I saw recently was that shared decision-making actually improved the ability of clinicians to engage patients in vaccines and accepting and understanding vaccines and their importance, and increased by 45% patients' willingness to do that. So again, we know that this has a broad applicability inside of mental health and outside.
So my focus is involving families in treatment and helping family members to help their loved one become the best version of themselves that they can be. So from my perspective, I think it's very critically important that families are also involved in shared decision making. We can definitely be an ally to the clinician as well as to our loved one. And I think it's important that we learn how to do that. I mean, in the beginning of the illness with my loved one, I felt like I had to direct his care. I had to make decisions for him because I felt he was impaired. And, after a few years into it, I thought, wait, there are some decisions he needs to be involved in. And if he's involved in sharing these big decisions about his life, he's more likely to continue on with the medications or the treatment program. And so after a few years of this and that realization, I learned that, including him in his treatment plan and in these decisions and allowing him to say no sometimes to some things was very important for his autonomy and his personal growth. So families learning that piece is very important. We need to pay attention to what's best for our loved one. And in the bio, it says I'm a patient advocate. And when I first read that, I thought, am I a patient advocate? I thought I was a family advocate. And then I started thinking about it and I thought, well, who does the family advocate for? The patient. So therefore, we are all patient advocates. And ultimately, that's what we want. We want our loved one to be able to get to the point where they can make all these decisions on their own without our assistance. So involving families in the shared decision making is a good way for families to also learn from their loved one and learn from the clinician what our limitations are. We can also, because we know our loved one better than anybody else does, we can interpret information that's being shared and perhaps help the communication between the clinician and the patient. We can take the buffer sometimes and help them to work together better, and just we can oversee the treatment plan and make sure that our loved one is adhering to the agreed upon treatment plan. So I think it's a very important thing to have the families involved in this shared decision making. Ultimately, it is up to the patient to make the decision. But if the clinician and family can also have a part of that and help to educate the patient and help them understand that we are looking out for his or her best interest, then shared decision making can relieve a lot of stress in families and just take the burden off families. So, that's for me the value of families being involved in shared decision making.